Well, I'm sure we can all guess that the topic for tonight's conversation is strong bones for the rest of your life, and also how to avoid osteoporosis for the rest of your life as well. When we were created, our skeletons were not created to degenerate and become osteoporotic as we got older. They were meant to last us for a lifetime, and that's something that a lot of people today don't even understand or realize. So a lot of things that these days that contribute to it are lifestyle factors, and genetics also play some role in the prominence of this in our society today. But what we're going to talk about today is just some things about osteoporosis, some of the known causes and factors that come in with this disease, and then because we know that, we can also determine some things that we can do to improve and make things better for our patients. So osteoporosis, what is it really? Well, if you break down the word, it literally means that the bone has become more porous, or porous bone. Due to the reduced amounts of bone, it's not demineralization, which is a lot of people think that like, I'm just losing calcium out of my bones. No, you're losing a lot more than that. You're losing actual bone density. So that's a kind of a common misnomer. 44 million Americans affected every year, which is a pretty significant percentage of our population, 44 million people. 1.5 million fractures per year. This is looking primarily at weight-bearing bones are most commonly affected. So we're looking at things like the femur, things like the spine, things like also your ribs are commonly affected. Of the fractures, I believe it's about 250,000 of them are just hip fractures, and about 600,000 to 700,000 of them are vertebral fractures. So when you think about both of those types of fractures, fracturing a hip will immobilize you for months. When you're immobilized like that, you're in the hospital, you increase your chance of acquiring an infection there, or you end up going to a nursing home in order to recover. Either one of those situations, I'm sure most of you know that going through a hip fracture like that is actually kind of the beginning of the end, so to speak. A lot of times people do not recover from these, and they it ends up leading to their death. For something as simple as a hip fracture, just because they can't recover and they catch something that renders them useless. So, and the other thing is, if we have a vertebral fracture, the spinal cord is traveling through the vertebrae, and it can be very affected when we have crush fractures and osteoporotic fractures in the spine. So that's something we definitely are concerned about, especially in chiropractic, since we deal so much with the spine. Very controversial, though, this whole subject of osteoporosis. It's very controversial in its prevalence as to how many people actually get it or are at risk for it, and also as to the cause. We'll look at that a little bit more here later. And also the treatments, which again we will see here a little bit later. There are lots of different variations in how people go about treating osteoporosis. So to start off here, we'll just look at a few of the risk factors that are involved with osteoporosis. The first being age. As we age, we don't recover as well, we don't turn over our bone as well, and it becomes worse and worse, the quality of our bone as time goes on. Gender is also another thing that plays a role in this. Women are more commonly affected than men, although recently men have started catching up with women. It's been kind of an interesting thing to see over the last 50 years that's been happening. Inactivity and nutrition, these are both things that kind of deal more with lifestyle. They will have a lot to do with how the health of your bones will be for years to come. There is a genetic and a family history component. A lot of times, if somebody in your immediate family has had osteoporosis, it can leave you at a higher risk for developing it. Ethnic background. Both Caucasian and Asians are more prone to getting osteoporosis, whereas other races do not have that prevalence. So, and you saw that on the questionnaire you were filling out here at the beginning that asked you what your nationality was. And that's why that's important. If you've had any sort of intestinal or gastric surgery, it can impair the calcium and the different minerals and the proteins being absorbed, and it can lead to the bones becoming more porous. Prolonged antacid use, this kind of goes along with the gastric surgery type thing. If you don't have enough stomach acid to be able to break down the calcium supplements that you're taking or the calcium that's in your diet, it will not be absorbed through the digestive tract and can't be assimilated into your body and used for your bone growth. Hyperthyroidism, hyperparathyroidism, these are both diseases that deal with hormone imbalances. Hyperthyroidism, thyroid hormones drive up your metabolism. You'll actually burn through your bone faster, and it'll turn over, and you'll have more calcium spilled out and excreted through your body. Hyperparathyroidism is a problem with parathyroid hormone being released, and it'll actually drive more calcium out of your bones. And we'll talk a little bit about parathyroid hormone in a little bit. Long-term corticosteroid use or anticonvulsants, both of these drugs are known to pull calcium out of the bone and put it into circulation to be excreted from the body. So being on those for a long period of time can also be a risk factor for developing osteoporosis. It also depends on kind of how your body composition is. Short-statured and lean-framed people do not succeed as well when they get into their older age with osteoporosis. It's actually more beneficial to be carry a little bit of extra weight on you so that you load the bones a little bit better, and to be a little bit taller in this situation. The last three things here: women who have never been pregnant, women who experience menopause early, or women who are postmenopausal. And another one is women who have had their ovaries removed are all also increased risk for osteoporosis. And the other thing about this is that they're also more of a candidate for hormone replacement therapy when they get to that time in their life. So how do you know if you have osteoporosis, or how do you know if you're at risk for getting it? Well, one of the things we use is questionnaires, which I know you all have found already, and this has a lot of good information on it that gives us some clues as to whether or not you're going to be prone to develop osteoporosis. So that can help us assess the risk. But to know whether or not you really have it, we really have to do a bone density study. One of the things we can do is a plain film study, like we do in the office here. We just take a regular x-ray. A lot of times we can see if there's been a loss in bone density there. However, by the time that actually shows up on a plain film x-ray, it's usually pretty far along in its course. Usually you've already lost 30 to 40% of your bone mass, so something that definitely is concerning. Really, the gold standard for determining whether or not you have osteoporosis is doing a dual energy X-ray absorptiometry study, or a Dexa scan is probably what you are more commonly heard of. And this is an example of one down here. What they do is they take and analyze the hip, and they also analyze aspects of the lower part of your spine. And then it will graph and show where you kind of are along the continuum of bone loss. So it's actually very, very interesting technology that we have, and it's very good for getting a baseline, especially women who are just reaching their menopausal years. This is something that we really highly recommend so that they can kind of know where they're at when they begin, and then we can kind of monitor through some different testing later. Another thing we can do is CT imaging, which is probably the best way to do it, but the thing is you're exposed to a lot of harmful radiation. So usually we're fine with doing a Dexa scan, and that gives us more than enough information. Urinalysis is listed here as well, and that's one of the things we can use to monitor either the rate of bone loss over a period of time, or to monitor how efficacious the treatment that we're doing is. Because the pyridium and the deoxypyridium will be measured in the urine. If you're losing bone mass, those are going to show up in higher amounts. So that's something we can do to assess as you go along through your years to know if you're losing bone continually. So we're going to talk a little bit about bone development and bone physiology to kind of understand a little bit better how the body is affected through osteoporosis. So bone development is really kind of spiking during the first 40 years of your life. You begin with the cartilage kind of base for all your bones, and then it works its way until you ossify or you become more bone-like in all of the different skeletal structures in your body. And this usually happens throughout the first 25 years of life. That's when you really reach your maximum ossification or bone laydown. So this is really the best time to start prevention. You want to make sure that you're active during those years, and that you're also eating good nutrition that will facilitate good bone laydown. About the time we hit 30, that's when we really reach our peak bone mass. That's really what we want to achieve, and we'll see this on a coming up slide. That this is when we really want to get to that point. So you can see kind of here in a visual what I was talking about on the previous slide. That here from when we're born to about the time we're 20 is when we're increasing in bone mass. Then here from the 20 to 30s when we reach our peak bone mass. And then when we get here 40s and 50s, especially women in their menopausal years, this is when bone loss becomes accelerated. And this is what we really need to avoid. We want to try and keep this peak bone mass and just keep it going so we don't have this accelerated bone loss followed by gradual loss for the rest of your life. So when we look at bone physiology, bone is actually not a stagnant structure in our body. Bone is constantly being remodeled, and it is constantly renewing itself. It's about 10% every year of your skeletal structure is reabsorbed and relaid down. So roughly every 10 years you have a new skeleton entirely. Everything has been totally revamped. And it's accomplished through two different types of cells, osteoblasts and osteoclasts. Osteoblasts are cells that are going to go in and lay bone down. Osteoclasts are going to be the types of cells that are going to break bone up and release it into circulation. And both of these are under influences of nutrition, different loading stresses, so like when you're exercising, and also hormones and regulation from your kidney and liver as well. You can see here it's kind of a small picture for you, but it shows the osteoblasts here laying down bone, and then here you can see this kind of divot here in the bone. The osteoclasts are just kind of eating it away. So that kind of shows you a little bit what they're doing. They're constantly doing this. It's a process to remodel and make your bone better as we continue to age. It's when this process begins to break down that we start developing things like osteoporosis. So when we look at bone, it's really made up of two major constituents. There's the organic portion and the non-organic portion. The organic portion is more the connective tissue and the proteins, and then the inorganic is more the minerals. So you're looking at your calcium, your phosphates, your magnesium, copper, boron, lots of different things that are involved here. And this is a little bit better microscopic structure of what's going on. You can see that here's the protein fibers in here with some protein fibers, glycoproteins kind of linking them together. And then you have the different the different mineral components that are then here as well. And this is a little bit bigger diagram here of what's really going on. You can see the collagen fibers, all the proteins running through here with the different minerals kind of interspersed throughout. And you actually have this in one of your visuals, the Healthy Bones for a Lifetime visual. And it's actually a really interesting picture and kind of helps you see a little bit better what's really going on with your bones.